In this video, I'm going to show you how to complete your one-pager for 1.3. You'll need to come here to get the disease dictionary. It's possible that we've got this before in a class, before today. If you don't have the disease dictionary already in your Google Drive, you want to grab it from here. So we'll make a copy. This is something that we're going to be using on several assignments in Unit 1, so please make sure that this goes into your Google Drive folder for medical detectives. It is not something that you will be turning in, but it will be a reference that you will use on different assignments, so you don't have to rename it because it'll have the same information in it every time. So you can click on a disease, a microorganism, and it will take you to information about that disease. We can see here that this is E. coli. E. coli is a bacteria. It has its incubation period, which means how long it is inside the body before symptoms could show up. So you could get infected with E. coli and 1 day later you could be sick, or 10 days later you could be sick. And then the duration of the illness is 5 to 7 days, meaning as soon as your symptoms show up, you can expect to be sick for almost a whole week. And then we have different symptoms. We've got severe stomach cramps, diarrhea, which can be bloody, vomiting, low-grade fever, dehydration, meaning that you've lost a lot of fluids and you need to get rehydrated, and then we have some severe causes. The ways that you can get the disease is the transmission of the disease, so it could be foodborne or airborne, food contaminated with feces. Common contaminated waters include raw or uncooked meat, unpasteurized milk, or lettuce. Can be spread by people preparing food who have not washed their hands after using the toilet. And then it gives you the treatment. So the treatment for this is fluid and salt replacement. We also know that it's a bacteria, so we can use antibiotics if it's severe. So here, if you have some words that you don't understand, I have them down here as definitions. And then you can come back to your table of contents by clicking on this link if you need to navigate to a different disease or you're trying to research a disease that a patient might have. So you may use this information to help you on your one-pager. So looking at the assignment, you will need to create a one-pager, so like a poster, that will tell us what kind of disease agent your disease is. So what kind of microorganism. It is either going to be a bacteria, a virus, or a fungi. You will need to show us a picture of your disease, either at its molecular level or basically it on the body, but make sure that you show appropriate pictures. It needs to be in color and it needs to be neat. You will include the following information. Symptoms. Let us know which one the host most commonly shows. So if it's something like E. coli, we saw that people are definitely going to have diarrhea. And so if you want to research that using the internet, you can look at that. The transmission of the disease, so how someone gets it, what are the treatments, and then what are ways to prevent getting this. If you want to use Canva, because you are familiar with the website Canva, you can use that to create your one-pager. You can also come here and use this template. This is a Google Slides template, and because we're making a one-pager, it can only be 1 page long, so you will not add any more slides. This just has some placeholders for you to put the information. Here are some examples of one-pagers. So here's measles, and the important information or the titles are bolded. This is easy to look at. It includes all of the information. It has a picture. This one's blocked off so that you can see it. So there are different ways to make this, and it's just 1 page. How to create your one-pager, you'll need to click here down here to see what microorganism you have been assigned. This assignment is due at the due date, so make sure you check that in Canvas. It is something that you should be able to get done today, and so make sure you're paying attention to what you need to finish. If you have any questions, you can always ask me when you see me in class, or you can email me. Have a wonderful day.